Okay. Okay, welcome everyone. This is our 13th prevention talk. In this one, as we were mentioning before, a very important topic that has generated a lot of interest in all of you. We will be talking about the role of law enforcement in community-wide prevention programming. Well, first of all, I want to welcome Dr. Zili Sloboda, our president of Applied Prevention Science International. She will be introducing the role of law enforcement in communities and how police science and the goals of law enforcement provide a framework for engaging prevention professionals in addressing substance use in communities. Then we will have Dr. Wadi Malouf, the Program Manager of Prevention, Treatment, and Rehabilitation Section in the United Nations Office of Drugs and Crime, and Dr. Chris Ringwald, Senior Scientist at the Pacific Institute for Research and Evaluation and Adjunct Professor with the University of North Carolina School of Public Health, They will be also doing a presentation and adding comments for and discussion points to the presentation. We will welcome all your comments and questions via chat, if it's possible, which Susan and I will be monitoring. And we really want to ask you to please mute your microphones while we are presenting and discussing. And again, welcome all of you and thank you for being here today. So Zili.
Okay, well, thank you very much for being here. It's really wonderful to see old friends as well as new friends and around this important topic. Let me see. So what on my agenda is sort of setting the stage for discussion. I'm going to be talking about what we know about vulnerability to behaviors like substance use, because to structure the role of prevention professionals as well as law enforcement professionals, the need for multiple evidence-based prevention programming, the role of law enforcement, and how law enforcement and prevention professionals can work together. So I thought let's talk first about vulnerability. Some of you may have seen this model before. As you know, since the early 1990s, with the publication of Hawkins and colleagues' work at the University of Washington, the paper that they wrote on risk and protective factors associated with the initiation of substance use. Prevention professionals really had that as a great model and framework when they were planning and implementing prevention programs. However, since that time, we know that we have evidence from research that risk and protective factors are only indicators of these behaviors and showing what makes somebody vulnerable. And these processes that underlay the risk and protective factors results from the interactions between individuals and their micro and macro level environments, as shown in this graphic. So the micro level, as most of you will know, family, school, peers, workplace. Macro level is the greater environment around us, our social environment, our political environment, includes laws and regulations, and then of course our physical environment. And many of us in the field now are concerned about climate change and what the role of prevention can be in addressing those issues and challenges. So these interactions shape our beliefs and attitudes and competencies that guide our behaviors. Behavioral scientists call this interaction socialization, and the influences in our micro and macro level environments are socialization agents. So given this framework suggests that there is more than one path or process towards a behavior such as substance use. So with this understanding, then, it is important that multiple evidence-based prevention programs be available in our communities. Some of you who are familiar with the international standards on drug use prevention will recognize this very complex graphic. I'm not going to go into details, but the international standards that was developed by WHO and the United Nations Office on Drugs and Crime summarize the array of evidence-based prevention interventions that are available by age group, as you can see across the top of this graphic, and within the settings along the side, including family, school, community, workplace, and the healthcare sector. So addressing substance use as well as violence and other disruptive behaviors in a community is not the sole job solely of one sector of the community, but impacts all sectors and is a community responsibility. Substance use prevention is not the responsibility of a school alone, as we know happens so much across all our communities, nor is it the responsibility of law enforcement alone. It is the job of all the sectors, and they should all be involved in providing comprehensive prevention interventions. So I always love this graphic. We know that many of the services, they are maybe available in our communities. So having them all over is not surprising. However, they may not only be difficult to access, but also to identify. I mean, we know that, for instance, social workers may not think what they're doing is prevention. They may not think of themselves as prevention professionals, but they're doing work that's really important for us as prevention professionals. So this indicates that we can see in a community all these things going on, but where are they and how can you identify? It's not like you can open a telephone book in the old days, remember telephone books, or look at a GPS and identify it. You can identify a treatment program, but you can't really identify a prevention program. And I think that's been a challenge for us in the field. So one type of effort that has been found to be effective, not only in pulling these prevention services together, but also in impacting substance use rates in community, is to develop a formal prevention implementation and delivery collaboration. This collaboration then can coordinate and monitor prevention services within a geographic area. And these collaborations you're familiar with, they might be community coalitions, community partnerships that go by a number of different names. What they do is they bring all of the prevention services to the table to avoid duplication of effort, to monitor what services are being delivered and what their effects are on problem behaviors such as substance use. And they identify what the gaps are in the need for services. I look at these as a service delivery system within the community. And we're going to probably have a talk later on this next couple of months and talking about service delivery system. We're preparing some prevention nuggets on what does that mean? What does a prevention service delivery system look like? So look for that over the next few months. So what is the role then of law enforcement in the prevention of substance use? So before we talk about law enforcement, let's get on the same page about what we mean by prevention. And here we have a general definition of prevention that is gaining international support through the UNODC work. So prevention addresses the health and safety of individuals through improving socialization processes that we talked about before, to enhance self-realization and participation in society. And with 3 decades of prevention research, we have now a scientific base for what we're doing in prevention. And as we see here, we've developed the term prevention science. This is really new. As you can look at the bottom of the slide, if you can see it, the dates when the field has been sort of defined. So started out with the standards of knowledge from the Society of Prevention Research, 2011. By the way, we're updating that now. But also the National Prevention Science Coalition here in the United States, as well as our organization, APSI, have developed definitions of prevention science that are beginning to be embraced. And so what we know, as we see here, prevention science informs prevention programming and implementation by identifying the determinants of behaviors that impact the social, emotional, and physical health of individuals, families, and communities. It provides an understanding as to how these determinants operate And because of this understanding what happens, what the processes are, we can develop strategies that can be used to intervene, particularly with these negative processes and where these processes are positive, to reinforce them. So prevention science is really not just one science, but it is informed by multiple sciences, as you can see in this slide here. Prevention science is important because it helps us identify who's at risk, what puts them at risk, and how best to intervene for them. Now let's talk about law enforcement. What do we mean by law enforcement? So law enforcement describes the individuals and agencies responsible for enforcing laws and maintaining public order and public safety. Law enforcement is also informed by police science. And police science provides the basis for how to prevent, detect, and investigate crime. Policy science is part of a police science is also multidisciplinary, as you can see at the bottom of this slide. So they have that in common. And why are we not going forward? I'm having a glitch here, guys. I'm sorry. There we go. So police science is important as it helps to make policing and law enforcement evidence-based, so to eliminate ineffective practices and to deliver services that are beneficial and cause the least harm. Now, we know that we have these things on paper, and how they're actually implemented in the real world is a big challenge, of course. But we're going to be thinking very idealistically here. So we see that theoretically, law enforcement and prevention share some objectives and goals. Law enforcement addresses public order and public safety to enhance productive participation in society, while prevention addresses health and safety to enhance self-realization. And combined, they can help to produce healthy and productive communities. Where are the points of intersection? I list a few here. You may think of others. I think that Chris is going to add to this list. Prevention and law enforcement professionals can work together on evidence-based policies related to such behaviors as substance use, on the development and enforcement of the use of these substances, the community, as well as norms regarding substance use. So you can see, we can talk more about this in our discussion. So points, in addition, we see points of intersection. Prevention and law enforcement professionals can work together around evidence-based workplace programs, school programs. We can work with drug courts in conjunction with substance use treatment professionals and juvenile justice system. And as you may have other ideas of where this intersection can take place. So what we're saying here is that law enforcement professionals and prevention professionals can work together to create our healthy environments in our communities. They can help deliver evidence-based interventions to change the context in which people operate. And it'd be great to bring law enforcement to the table, as we talked about before. And how to do that, I'm talking to our prevention colleagues here in the United States. A lot of them ask that question: how do we bring law enforcement to the table? So law enforcement not only enforce laws and regulations regarding the accessibility and availability of tobacco, alcohol, and now cannabis in many places, but also my epidemiology hat on. Law enforcement is often the first place where you can find out what's happening on the street, what kinds of drugs are available on the street. And if they're doing tox screens of the analyses of these substances, we learn what the adulterants are. There's a lot of new articles out in the literature looking at the adulterants, and that are used to cut street drugs, and we're learning that some of them are lethal. It may not just be fentanyl; it might be other things in that are adulterants in those substances that are harming substance users. But also, we also know from law enforcement new modes of administration of drugs. We learned about injecting crack cocaine back in the 80s, how that was done. We learned it from our law enforcement colleagues. And of course, they also can begin identifying, as our treatment colleagues, new groups, new populations that are involved with drugs. So this is important. This is important information not only for prevention professionals and treatment providers, but also for our health professionals. So how do we get them to the table? I think that's a great challenge. And when they get to the table, how can we help? How can they work together? So we need to, one of the things that I think is important is that we need to, just like we all in the prevention field need to be talking the same language in terms of prevention, we also need to bring our law enforcement colleagues on board. They need to understand what prevention science is. They need to be trained. And they need to be monitored. The work they're doing needs to be monitored. And then, of course, everything we do, both in prevention as well as with the police, is within the framework of ethics. So that's setting the stage. I'm going to turn this over to Chris Ringwald. Dr. Ringwald?
Well, thank you, Zelie. That was an excellent and most comprehensive introduction. You will hear me repeating and emphasizing some of the excellent points you made. This is who I am, but let's move right along because I know who I am, and it's not really very interesting. What I have done to organize this very brief part of this presentation is to think through some preliminary do's and don'ts for law enforcement. I only put this together yesterday, and since that time I thought, well, this list could expand indefinitely to include more and more things as we think together about the role of law enforcement in prevention, and over time, as our understanding of effective law enforcement behaviors and actions, what they are in relation to the prevention of the problems and the concerns that we are focusing on today. So I have 2 slides of do and just 1 of don't, and then I will release you to the rest of the presentation to water. So first, be ambassadors to the community to describe the key role law enforcement plays in the prevention of substance abuse and its consequences. I think there's a general perception on the part of the public that the purpose of law enforcement is to respond to emergencies and apprehend criminals and to restore public safety, which in the analog to the substance abuse field is more treatment than prevention. We have the radical notion that cops, law enforcement should span the spectrum from prevention through restoration of public safety, and that there was a role all the way through here, which I think has yet to be fully articulated, but let's get started. Law enforcement can help identify problems in the community, where they are occurring, and who is affected. So that law enforcement can get the word out as to who is being affected and who is being damaged as a result of the concerns, and what can be done about it. Law enforcement can also bring the community together around common concerns and support substance use prevention coalitions. Many communities already have existing coalitions that are focusing on one or another aspect of substance abuse prevention. Those need to be nurtured and supported. In other places, the community may yet cohere around the identification and prevention of substance abuse problems. And here is a key role that law enforcement can play in bringing together all the disparate elements of the community that Zelie talked about in her speech. Prevention is indeed all over the place. Just try to figure out where it is and who is doing it, and then persuade them that they are doing it and they need to be part of an overall coalition for prevention can be a real challenge. But I believe law enforcement is potentially in an excellent position to do just that. And of course, law enforcement can spread the word about prevention-oriented policies and what law enforcement is doing to ensure compliance with them. And this is more of the introduction side and less on the prevention side. What we're looking to do here is to persuade people that there is a law enforcement presence in the community. It is concerned, and if you violate substance abuse policies and laws, you will be apprehended. Next slide. Thank you, Zelie. So here's my second slide of do's, with the do's and don'ts. This is the do's. Stress the importance of reducing children's and adolescents' access to alcohol, tobacco, and other drugs. Many, many reasons to do this. You all know them. One of them is to simply talk about the damage that substance use does to the developing brain in children and adolescents, all the way through into their mid-20s. You can encourage responsible drinking by adults in entertainment venues, by the enforcement of a variety of policies, including responsible beverage service and sales. You can eliminate impaired driving, or at least greatly reduce it, by setting up checkpoints and advertising them wisely in areas and at times and places where there is a high likelihood of impaired driving, late at night, shortly before or after the bars close. And to the extent that your community and your society support them, you can be very supportive of harm reduction initiatives, and particularly needle exchange programs and opioid overdose prevention. Everybody should be carrying naloxone in law enforcement. Everybody should be equipped with this life-saving drug. But there is so much more that can be done, including supporting and working closely with sectors of the community that are, say, involved in needle exchange programs. Or more radically, and this is not for everybody, but I think it certainly deserves attention, is supporting safe sites for the injection of drugs. All of this prevents sickness and death. All of it is part of the full armamentarium of prevention strategies that law enforcement can adopt and use and promote publicly. The public will listen to law enforcement at a time when it may not listen to other sectors of the community. Next slide, please, Zelie. Thank you. So here's one page of don'ts. Don't conduct raids on venues like crack houses where people are using illegal substances. Avoid no-knock tactics, busting into people's homes. Do what you can do, everything you possibly can do to build trust and relationships in the community. Don't use heavy-handed tactics in the schools, like locker searches and drug-sniffing dogs. It's going to alienate you from students. Don't provide information to students about various substances and the consequences of using each. We have known for years that simply teaches students to be more intelligent and better consumers of substances. And don't tell stories to students about struggling with addiction or overcoming addiction students are very sophisticated. They tend to laugh at that. And they all know people, adults and peers, they all know people who use substances regularly without any ill consequences. So they won't believe what you tell them. And I think that's the end of my little presentation.
Thanks very much, Chris. Wadi, I'm going to stop the share so you can do your slides. Okay, you ready?
Yeah, I'm waiting just to get the
Okay.
opportunity to share. Yeah. So, can you see my screen? No.
No, not yet.
Okay.
There we
Now
go.
we can.
Better now?
Yep.
Okay. Sounds good. So I'll try to complement the great presentation that Zili and Chris set the stage for, in the sense of, our perspective of UNODC, because this is, I think, the common point that we're approaching as UNODC is that concept of culture of prevention that, I see Hano joining us. There was a special edition from Prevention Science focusing on that culture of prevention, which is key. And this is our starting point as UNODC when we engage with our member states, when the people, our stakeholders we work with, it just changed that culture of prevention. That I know we're talking about the law enforcement component of stakeholders of the response, but that culture of prevention is sometimes missing across the different stakeholders of the response, and it's not unique to law enforcement officers, not to be pinpointing, but it is an essential component for us as UNODC to have a proper culture as described by Chris and Zili in terms of that science of prevention, when anybody who's involved in the prevention response is aware of. And it is in that context that UNODC, further to the document that Zili mentioned, which is the International Standards on Drug Use Prevention, let's say our Bible when it comes to work on prevention in the field, we try to kind of focus on how to improve the role of law enforcement in that context of that culture of prevention that we're preaching. So the main element that we're focusing on, and I draw your attention to the fact that this is by WHO standards as well as prevention. In the context of COVID-19, you can see how stringent is that selection of, the evidence of what supports prevention that we can propose moving forward for any country implicated in drug prevention by WHO standards. So in that context of what we can avail, the main etiological model is what Zili kind of put the finger on. It is the main element of the culture that needs to be shifted is the fact that it is not a free and informed choice that an individual can say yes or no to. There's a set of vulnerability at the individual level. People have different reactivity to stress, have different cognitive knowledge, have different abilities of cognition, have different mental health status, have different sort of genes, things under their skin. And these individuals live in context of microstructures that Zili will talk to, families that could attenuate or accentuate these vulnerabilities, depending on how the functioning is within this family, school as a microstructure, the peers. But even these microstructures exist with macrostructures outside them. A family that functions in a context of, for us as UNODC, of displacement or conflict or social inequalities is different than a family raising their children in normal circumstances. So the microenvironment carries an impact on the microstructure and also, of course, carries a direct impact on the individual self. So there is more than an individual should just say yes, just say no. Imagine a child, for example, with high reactivity to stress, living in a dissociated families with problems in the family, poor attachment to school in a context of displacement, and the prevention program is focused on like just say no to drugs, or here are the information of drugs. And this is the additional message that the prevention standard try to focus on, is shifting that lens of focus, because in many instances the lens is on the drug, the substance of concern. And we're trying to move it to a context of like, think about the individual, the person. in the context that that person is living in, at what age of development, and what milestones of development that child needs to pass that milestone, that period of development in a healthy and safe way. An infant would need this. A child that starts speaking and is not ready to school will need that. A child in early period of schools that is exposed to new kids in his or her environment, moving to a new social environment for the first place, needs to socialize, recognize his or her emotions, the emotions of others, needs that in order to kind of socialize in a normal way. And an early adolescent needs this when looking to other adolescents and seeing what do they do and having that normative belief, everybody smokes, everybody drinks, or not, that normative context. And an adolescent, when I'm going into like adulthood and I'm taking these risks, what should I do? So it is that context that requires these packages that Zili and Chris talked about, in the sense, and that's where the evidence is, things that help the child at different ages of socialize in a normal and healthy way. And this is why we have a spectrum of, oh my God, you can start prevention with WHO standards from infancy, even from prenatal period up to adulthood, yes. And there are several social structures that accompany and nurture that child to grow in a healthy and safe way. You will see in that structure that we don't have law enforcement per se as a structure that really supports the development of the age. But does that mean that law enforcement does not have a role in providing that safety and support of the child growing up? We see that from a context of development as well. We talk about the individual surrounded by the family, surrounded by the school, and the school exists in a community, and the community is in a social context. There are different stakeholders, as Zili kind of suggested, that play an element of safety around that individual. And it's very clear that the law enforcement officers are part of that safety component, whether in school, around the school, or at the community level. So there is an element that they can play under that etiological model that Zili has proposed. Now, what do we have as a challenge? We have as a challenge that in the countries where we work in, specifically low and middle income countries, security ministries hold the rein on drug control policies. And they have the drug control strategies. So in many instances, under even the demand reduction portfolio, while treatment is delegated to treatment services, the prevention element is many times well funded by these security ministry, whether it be like interior or security or safety or law enforcement in general. And they have the funds and they have the personnel to do the work. At the same time, as I mentioned, in terms of evidence with WHO standards and in terms of, Zili was a key component in terms of reviewing that evidence, NIDA and other sort of agencies, there is no clear evidence for a law enforcement-led program that really sort of articulate work on the ground for drug prevention purposes under that etiological model, as well as with evidence on terms of impact of substance use. But there is elements, what we know, that of course, it's a law enforcement agency. And we have lots of evidence within the standards that have been described to you where environmental strategies, like, removing access to kind of purchase of tobacco at a young age or alcohol at a young age or selling alcohol around the schools. All of these are environmental policies that are effective. So how can the law enforcement play a role in this? And in the perspective of like law enforcement having the personnel, having the capacity, having the funding, having a role that they can play in the safety and security of engagement in prevention. Is this a missed opportunity in many countries just to sideline them, moving aside, saying like, listen, we have the science saying this is what works. What Chris has pinpointed is very important because these are ingredients per the prevention standards. By the way, they're not only for law enforcement. Any entity going to school, these are do's and don't in school settings in general, in terms of prevention. But the law enforcement is coming in from a perspective sometimes of a lens of the drug being a problem. And when you're coming in with that perspective, with that culture of coming in, with engagement in prevention, so most of the focus will be on awareness raising, and rather than the larger perspective of that culture of prevention that's there. And this is an opportunity that we wanted to capitalize on, the presence of these law enforcement, helping and steering them in a perspective to really support and be an active part of that multi-stakeholder community coalition in terms of prevention that really is geared on in that lens of healthy socialization and supportive, nurturing environment for the child to grow in a healthy and safe way. And this is why we have developed that. We're in the process of developing these guidelines. Many of the colleagues on this call have contributed to it, which I'm grateful. But for those that haven't, you can see the protocol in terms of where we stand in terms of initial research. And this is a slide I've shared. The link is there. That article can be read by all. And we're in the process of developing the first draft of these guidelines. And these will be provided to our Commission on Narcotic Drug, our member states, to really sort of reflect more in terms of what they can do in the field of prevention and different perspectives to capitalize on law enforcement. And I would really hope within this discussion today to hear more and more opinions that could be also guiding light for us in terms of how we can really steer the boat in the right direction for law enforcement officer to be moving in the direction of really adding an added bonus to that prevention science and to the prevention and healthy and safe development of youth. So with that, I pass the floor back to you, Zilli or Chris.
I think the floor is with Maria and Susan right now.
Oh, Maria, thank you very much.
We've been getting comments in the chat.
Yeah. I can start with Richard Gagunkyu. Hi, Richard. We haven't seen you in a long time. And you asked the question, which is always a good question. Chris, I think it might be directed to you. Would like to understand how you can encourage responsible drinking when only once one starts drinking, the drink takes over. Chris, would you like to comment?
I'll be pleased to. There are a variety of strategies that are now being suggested by all sorts of people based on research, and including endorsed by NIAAA here in the United States, that relate to encouraging responsible drinking. One of my favorites is to drink zero alcohol beer. Zero alcohol beer is increasingly being developed and marketed all over the world. And of course, as the name implies, it's fine for children and adolescents, except to the extent that it enhances brand awareness and may set up a trajectory for future drinking, but I don't think we know much about that yet. Another strategy is to consciously limit the number of drinks that you have in the evening and to interspace alcohol consumption with eating snacks, drinking water. That means you make water readily available on the table for, say, young adults, so that they will not simply consume alcohol, one glass or one can after another. There's also a variety of strategies under the aegis of responsible beverage service in which bartenders are taught how to recognize signs of inebriation, inappropriate drinking, and to cut people off without causing offense and losing customers.
That sounds great. Thank you, Chris. I'll go on. Dick Clayton, great to see you again, Dick, has a number of questions that he's linked. Here's one. What is known about the extent of involvement of law enforcement officers in coalitions today? He thinks it may be more than we expect, maybe more pervasive than we think. Zilli, do you have any?
No, that's a really great question, Dick. I think that they may be involved, but still from our experience, we've been doing training of prevention professionals across the country, and those who are involved in coalitions, a lot of people are missing from the table. Faith-based organizations also are not participating as much, but I think that there is not a clear role of law enforcement. So they may be coming to the table, they may be not contributing as much. All I know is from what feedback we're getting, but I don't know if there's any data on that, Dick. But it's a really good question.
If I may, I think it's an excellent question, Dick, and I think it's the basis of your next NIH study. Please start writing a proposal. Let's find out how prevalent law enforcement is in community coalitions across the country, what their roles are, and what they think about how their roles could be enhanced, not only they, but other members of coalitions. And then let's come up with a set of best practices for law enforcement in identifying community champions and bringing together disparate aspects of the community that are interested in solving a particular problem related to prevention, and then running and conducting the process effectively so it leads to action and not to what I have heard called problem admiration. Ever heard that phrase before? Problem admiration. This is where coalitions get stuck and they can't move forward.
Well done. Maria, do you want to take over?
Sure. Thank you, Susan. We have another question from Ziad El Khatib. He asks, how can law enforcement officers avoid conducting raids at home if the policy expects them to do? And can they change their law enforcement activities without changing the law itself? It's an interesting question.
That's a challenging question.
Challenging question.
I can't answer that question. I'm sorry. I don't know if Chris or Wadi have any thoughts on that.
Wadi, I sure hope you have some thoughts on this.
I mean, from my perspective, it's just like, there's, I don't know, law enforcement plays a different thing, at least in my context. I'm not going to claim that I'm an expert in terms of law enforcement, but I see it from, there's a law that's been broken, and then there's, a safety environment that needs to be availed around the development of the child. I'm seeing it from that perspective of, that element of safety. And that role, when it comes to prevention, that is key. More than, there's breaking of the law and then they have to oppose. But even that sort of context of imposing the law, there's a big gradient in terms of we want to kind of fine tune that question. What is it? For example, in the school setting, the thing that is being addressed, is it a child that is discussing drugs? Is it a child that is requesting drugs? Is it a child that is seeking where drugs are? Is it a child that's selling drugs? Is it a child that's using drugs? And there's a big gradient, but it's not like, there's law enforcement regarding drugs and this is what we're going to do. And of course, the response in terms of law enforcement has to be, what is it in that context, in terms of a response? And this requires a contextual change of the law enforcement officer. What am I doing in terms of providing safety around that institution, if not around the child? But if the law has been broken in the sense of breaking of the law, this is a completely different context. That what is the role of the law enforcement from a context of providing safety around the child to grow in a healthy and safe way? And this is the distinction that needs to be driven. It's not like, taking away the role of the law enforcement in terms of improving their role in terms of really imposing the law, but what is their role from a prevention perspective, from a developmental perspective of a child, is what we're concerned with, I think, in terms of that element of a discussion.
Yeah, we actually, Emily Ongali, I hope I pronounced your name correctly. She says, I believe that raids are a way to execute the law. It is not a law to conduct a raid. I think that hits it right on the nose. And I think that's one of the problems, not only with law enforcement and prevention, but also prevention professionals and prevention. they need to be trained. They have to be engaged in how to achieve this end. You know, if the rate is to get drugs, you know, I don't even go that route, but anyway, you know, when we want to do prevention, we now have science behind how to do it effectively. And the problem is that we know not only law enforcement engaging, even in the enforcement of the laws about accessibility and availability, all the research studies that have looked at those strategies, those prevention strategies, say the way it is enforced is what's key to being effective. And so I think, thank you, Emily. I think that making that distinction, I think, is really important for all of us.
Yeah.
Thank you. So we have another comment from Dick Clayton. He says, I have often thought that supply reduction by law enforcement is primary prevention using the public health concept of upstream interventions.
Yeah, I think, Dick, you probably are the same wavelength, because that's what when I was talking about the major role of law enforcement. There are a number of people, this whole thing about what drugs are on the street, I think is really important, not what is in those on the drugs. In the United States, we're having a lot of problems, as you know, with overdoses. I live in Ohio. We're about third in the country in terms of overdose deaths. I was talking to some colleagues who are from the high-intensity drug trafficking area here in Ohio, and what is the content of the drugs? The content of the drugs here in the United States, the fentanyl that's coming in Ohio, is coming, they think, is coming from China directly, so it's more potent than a fentanyl that's coming across the border from Mexico. And that's why there probably are higher risk deaths there. One of the problems, and this is, again, I would reach out to our law enforcement colleagues, is we need to do those tox screens of what's seized on the street, because I think that's, if we're going to, especially from now we're with the movement towards harm reduction, that's really important, Dick. So I think you're absolutely right. We really need to understand not only what the content of the drugs are, but also I remember going to Interpol meetings when I was at NIDA, and you know the one part of the agenda was on how many drugs were seized, who had seized those drugs.
That's right. I remember. Yeah.
It's really important. Yes, drug seizure is part of our supply reduction. Unfortunately, if you look at our federal budget, most of the money, more money goes towards that than it does to prevention. So we need to be really creating a situation where people do not want to use substances, psychoactive substances, and get at that. That's why prevention from early on through into old age. Look at the rise in substance use amongst older adults in the United States. Who would have thought that there would have been such an increase? But there is. We don't have many interventions for older adults.
Thank you, Zilly. We have another question from Aisha. Hi, Aisha. It's good to see you. In most countries, the mandate for law enforcement agencies is enforcement, trafficking control rather than work on prevention. How can we encourage for a policy change from a hard to a softer image, meaning prevention?
I've been thinking about that, Maria, if I may take first stab at answering this question. I've been thinking about it a lot. It's like turning a ship around. There's a public image of what law enforcement is and what it does. And there is law enforcement's own image of what it is and what it does and what it should do. And broadening the scope of the responsibilities for law enforcement is going to take a very, very long time, I think, and be very, very difficult. Heaven knows law enforcement has enough to do as it is without messing with the prevention side of the equation. How is this going to happen? Slowly, thoughtfully, one law enforcement officer at a time. Having conversations with police chiefs, with superintendents, conversations with city councils and county administration here in the United States, for example, about the need to broaden the role of and responsibilities for police, law enforcement, pay them better, train them better, and see who is interested in moving to the prevention side or broadening their scope of practice to include prevention.
Can I broaden that answer in a different context as well? So this is part of a dilemma that also we were facing when we were putting this guideline forward. Our guideline was put forward not from a perspective really to invite the law enforcement officers to be part of the prevention response. And I'm saying that from a perspective of, from a prevention initiative, from a prevention system, there is a lot of evidence of lots of programs with many stakeholders of the response that are with evidence in terms of an effect. So we were also carefully kind of calibrating the introduction of that system from a perspective of when the law enforcement is implicated in the prevention response and they have a specific manpower dedicated for that, how can that role be improved and move forward, rather than just inviting the law enforcement really to play a role in a prevention response where there might be other entities that could play a more substantively effective role in that effect. So I also would like to kind of highlight that angle from the response as well, that maybe if the perspective is to provide that healthy development of a child, there could be a different vehicle that kind of apply this without the necessary need of a law enforcement officer to that effect. But in other instances or in other roles, the law enforcement officer could play a more substantive role as well.
I think that
Thank you. Susan, do you want to take over?
I'm happy to. EZC Connor wrote, if we are not supposed to tell students of the effects of drugs or the struggles of addiction, what are we supposed to say? I could answer that, but I'll turn it over. Zilly.
I think the point is that telling them about the negative effects alone isn't enough. It's then how do you, once you raise that awareness, once you connect that those effects to how they personally affect the individual, is then how do you help them not engage, not get involved with substance use? And obviously, evidence-based prevention programs for children, and please, my colleagues jump in here, include all of those components. Most evidence-based programs provide the skills necessary for refusal or non-engagement.
And also the developmental ages,
yes,
when and how.
Correct. For instance, I was approached by a couple of people here in Ohio that said that they were mandated to talk about heroin use in kindergarten. Yeah, I know. So, give me a break here. These have to be developmentally appropriate, obviously. It's extremely important. That's part of the prevention science that underlies our very effective prevention interventions. I don't know, my colleagues, do you want to add anything?
If I may, one strategy that is often employed in successful substance abuse prevention programs in school settings is to change students' exaggerated perceptions that drug use is normative among their peers. Typically, students think that everyone else is doing it and that there is presumed subtle peer pressure for them to do so too, when in fact, relatively few of their peers are doing it. And to the extent, and there are techniques and strategies to do this, but the technique that you can change these incorrect understandings, you can have an effect on subsequent substance use.
Yeah.
And it has to be very carefully done. It's very interesting because the outcome, the United States had a major media campaign around marijuana use years ago. And they talked, there was supposed to be a screening of the ads that were used, and that screening was not put into place. So lots of ads got on the air, and the outcomes were the children thought that everybody is exactly what Chris was saying, and reinforced that everybody's using drugs. Otherwise, why were they making such a big deal about it? Rather than using a theoretically based approach of communications based on, persuasion theory, et cetera. So yeah, it can have a really bounce. You can have a negative effect from reading this. It reinforces exactly those perceptions. So one has to be really careful. On the other hand, it's always for certain age groups, it's probably good for them to understand what substances, when they're learning about the brain and how the brain functions. Good for them to understand what substances, psychoactive substances, as well as other things, can impact the brain, and how that can hurt them, and helps them make informed decisions about substance use.
Zil, actually, this gets expanded a little bit. Bob Salt has written here, which I think will deal with a little bit of this same issue. This has been an excellent overview of a major threat in prevention, but my own work focused on alcohol-related harm that is normative, rather than focused on, say, vulnerable adolescents. In my case, working with the police is a strategy to change those norms or change the perceived norms. The challenge is that police are subject to enormous political pressure by other forces, so prevention requires boosting enforcement to alter community norms around harmful use, whether college students or population at large. By the way, my experience in the US, police officers do not want to attend endless meetings and issue for coalitions who have to adjust to a very different organizational culture. I think it underscores the concept of what is their role, and can you work with on specific things that do not require them to be part of broad planning, but to deal with what they can do. But any comments? Sorry.
Thanks, Bob. It's good to see you. It's been a while. I think that's very good. Those comments are really very good. And I sort of touched on that when I was talking about the role of law enforcement in terms of reinforcing non-use norms, or particularly for children and adolescents. So thanks very much for reinforcing that.
And next, Peter Clegg, one of our Utah folks. There was a slide discussing the don'ts of law enforcement activities that included the raids on venues. Does this include teen alcohol parties after a tip is given? I would have concerns, but that not checking in on the tip would increase perceptions of community laws and norms of substance misuse. I'm not sure I understand that.
I do. Yeah, so these are called party patrols. There's a party. It's spread, all the kids know about it. Word leaks out to the police. Sometimes the parents are present, sometimes they're absent, and kids are drinking in a house. And you raid. And you raid with teeth in your raid. And there's a long tradition of this. And I'm not saying it's wrong, but I am saying that it does drive a wedge between kids and the police. So I'm highly ambivalent about it. But it has been shown on occasion to be effective. So there you have it.
Any other comments or? Maria, would you like to pick up? Oh.
Up next. On the hour.
Oh, are we? Wait, well, we have
we've lost a number of people because they had other meetings to go to, other things they needed to do. So,
yeah. Well, you know what? We have some more comments. We might be able to respond by email later. Is that? Oh, yeah, we are. It's 11 o'clock. I think we might want to do that.
Yeah, I think this has been a great conversation. Thank you, everyone, for your participation. I'm sorry that we can really not go through all the comments. We understand that a lot of you have other commitments. Please We will be posting this recording on our website in the upcoming days, so you can see it again, share it with your colleagues, and we hope to do another prevention talk on this topic, because I mean we did have an overwhelming response. Unfortunately, there were some people who could not join. Thank you, Zili. Thank you, Chris. Thank you, Wadi. Thank you, everyone, for your participation. And Zili, do anything you want to do?
I just want to thank everybody, and it's always good to see familiar faces. Richard, it's Gorp. It's just wonderful seeing everybody, and hopefully we'll see you again in the future.
Bye-bye all.
Bye-bye.
Thank you.